living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
From bleeding gums to discolored nails to swollen feet, your body may be trying to tell you you are overlooking some health issues that need your and your doctor's attention. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today we're talking about when and how to listen to your body in case it's trying to send you signals toward better health. Stay with us, we'll be right back. Welcome back to Healthy Living for Life. Joining us this morning is Dr. Douglas Kunzweiler, the Chief Medical Officer at Mountain Pacific Quality Health, and Britt Ballinger, a certified nurse practitioner who specializes in cardiac health. Thank you both for being here this morning.
Thank you.
So this morning we're talking about ways that your body can signify that something might be amiss, and let's start with the hands and feet. So lots of people suffer from always having cold hands and cold feet. Dr. Kunzweiler, let's start with you. What might that indicate?
Well, it may be something as simple as it's cold out and you need to put on a jacket or put on socks. But it could be a variety of things. It could be poor circulation to your hands or your feet, and that can be a sign sometimes of diabetes or even heart disease. It's not very common for that to show up. And there are other things that can cause it. Low thyroid hormone is something that people will often complain about. Cold hands and cold feet. Stress, when we are under stress, our body releases a hormone called adrenaline. Adrenaline tends to shut down the circulation to the periphery. That is, it shuts it down to our hands and to our feet. And that can cause cold hands and feet. And then there are a whole variety of other things that mostly affect either the nerves to the hands and feet or the blood vessels to the hands and feet.
Okay, so Britt, can you talk specifically about what that might mean when it comes to heart health?
For heart health, we mostly see consequences in the lower extremities, in the legs and feet, and that can tell us that your heart might not be pumping as strong as it should be. So we see swelling. Sometimes people get cold feet because the circulation just isn't strong enough to reach that far. So it's definitely something that you should keep an eye on, especially swelling in your legs. It can tell us you have bad circulation to your legs, but it also can signify a problem with the way your heart pumps for a variety of reasons.
Are there ways that people can improve their circulation? Exercise,
mostly.
Okay.
Yeah, and don't smoke. But exercise is the number one treatment, especially if it is a specific problem with the circulation to the extremities. Walking is the best treatment.
Okay.
And
Sorry, go ahead.
And not smoking.
Okay, perfect. And so actually, speaking of smoking, we know that smoking can have a negative impact on several parts of your body. Can you talk a little bit about what it can do to your extremities? Dr. K, maybe we'll ask you that question.
Yeah, smoking causes irritation of blood vessels. It causes increased clotting. And this happens particularly with small blood vessels. So the coronary arteries in the heart are one area that smoking affects and leads to heart attacks and heart failure. But it does the same thing in the small vessels in your hands and in your feet. And so that can cause poor healing of cuts and scrapes. It can cause loss of sensation. It can lead to open sores. Smoking is just all around very bad for your blood vessels.
And so if you do start experiencing some swelling in your feet, what should you do?
Well, swelling can be caused from a number of different things, but you should get that checked out. I mean, it could be something as simple as mechanical. If you're not exercising enough, gravity is always pulling blood down into the lower part of your legs, and that could cause swollen feet and swollen ankles. And if you've sat in a car for a few hours, it's not uncommon for your feet to be swollen. That's pretty innocuous. But if you have fluid overload because your heart isn't pumping efficiently enough and your kidneys aren't removing the fluid, that can cause swelling. So you really need to get it checked out if it's something that persists more than a day or two.
Okay. Britt, would you have anything to add there as far as swelling in your feet?
No, I agree. I think if it's a new finding and your doctor isn't aware of it, you need to get it checked out because it can signify bigger problems.
Okay. And what about tingling? Britt, can you talk about what that might indicate?
Tingling in the extremities can usually signifies as nerve problems, and it happens a lot in diabetics. It also can, if you have low blood pressure, you can feel that, or low oxygen levels. Not specifically a symptom that we see a lot in heart patients, unless they're also diabetic. So it's common in diabetes.
And what about foot pain? Is that any indication of heart health?
Well, if your feet swell to the point where your skin is compromised, people will have pain, and swelling in the lower extremities can also exacerbate that tingling that diabetics have, that neuropathy pain. So definitely something to pay attention to if it's pain that happens at rest.
Okay, great.
Also blow, sorry.
Okay, no, that's great. And so let's switch really quickly and talk about hands. We know that clean hands are a big part of infection prevention. Dr. Kunzweiler, how do you know if you don't have germs on your hands?
Well, I guarantee you everybody does have germs on their hands. Our whole world is covered in bacteria and viruses, and so we pick them up on our hands. So just assume that you do have germs on your hands. Once you get over that idea, though, the way you protect yourself from that is by good hand washing. If you don't have soap and water available, then you should use an alcohol solution or an alcohol hand wipe. But everybody carries germs on their hands. Germs means bacteria or viruses or yeast or fungus. We all have it, but we need to wash our hands frequently to protect ourselves from it.
Okay, perfect. And that is actually all the time we have before we need to take a break here. So thank you so much to you both so far for everything about hands and feet. After we come back from the break, we're going to shift and talk about what your hair and nails might be telling you. Stay with us. We'll be right back after these messages. Welcome back. We're talking about how different body parts might be trying to tell you that you're having some bigger health issues. Dr. Kunzweiler is still with us. Thanks for sticking around, Dr. Kunzweiler. So let's talk about stress a little bit. We know that stress also, just like we talked previously about nicotine, stress can have different impacts on several body parts as well. What parts of your body should you pay attention to if you're not necessarily feeling stress, but your body is trying to tell you you're stressed out?
Well, some of the signs are our gut seems to be connected directly to our brain. And when you're feeling stress, it's very common to have abdominal pain, maybe crampy abdominal pain, nausea. People will often complain of either diarrhea or constipation, maybe bloating feeling. So our GI system is a common place for stress to show up. Tooth grinding, jaw pain, tooth pain, that's another very common one. And of course, feelings of anxiety, depression, maybe feeling like you're overwhelmed, feeling like you have no energy. Those are often actually symptoms of stress.
Can stress cause hair loss?
Yes, it can. When we think about hair loss and stress, usually we think about some sort of physical stress, like a significant illness or pregnancy. Often you'll see people have hair loss, but it also can be associated with anxiety and psychological stress. Our hair is growing all the time. The hair follicles are constantly growing out new hair. But when you're under stress, the hair follicles tend to slow down. Old hair is always being shed, and so the ultimate result of that is your hair will get thinner because the new hairs aren't growing when you're under stress.
Are there other health issues that can make your hair start to fall out or thin?
Yeah, there are. Some of the common ones are some of the autoimmune diseases like lupus, some of those diseases where you form antibodies to the follicles of your hair, and that can make it fall out. And then there are hormonal diseases. People who have low thyroid, their hair follicles stop producing, and so their hair will get thinner, and it often changes texture and become drier and more brittle. So that's a fairly common one. People who have an excess of testosterone, the male hormone, they can grow facial hair. And this happens in females sometimes for various reasons. And so there are lots of various things that can make your hair change its texture, change how thick it is.
So is the answer then dealing with those health issues, or are there things people can do to deal with the hair loss, or what's your advice there for that particular ailment?
Well, my advice first is to see your primary caregiver and try and find out what the cause is, because the various causes have different treatments. For instance, if it's low thyroid, that can be taken care of with thyroid replacement. If it's a circulation problem, that might require further testing and some other medications. If it's psychological stress, you might need treatment for depression or for anxiety. So it really depends on the cause. I would say the first thing to do if you have significant changes in your hair is to see your primary caregiver and try and find out what's at the root of it.
Okay, great. Let's switch and talk about nails now. Lots of times people might notice discoloration in their nails, maybe yellow or blue even. Can you talk about that a little bit?
Sure. I think the most important thing when you're talking about a discolored nail is if you see dark spot under the nail, maybe dark brown or black or blue-black, that could possibly be a type of skin cancer called a melanoma. And melanoma is a particularly bad skin cancer. So if you see something like that and there's no history of, trauma where you banged your nail or injured it somehow, it's worthwhile to have a professional take a look at that. Oftentimes, discoloration can be a result of a fungal infection, especially in our toenails. So yellow or greenish discoloration or maybe brownish can indicate a fungus or a yeast infection, and you should see a provider about that. There are nutritional problems. They're not very common in America because most of us don't suffer from malnutrition, but poor nutrition can cause changes in the nails, including changes in the color of the nails. Sometimes liver disease can cause the nails to yellow, the skin and the nails to yellow. So if you see something that you don't have a ready explanation for, like, your nails were exposed to a hair dye or something like that, then you should see your primary care provider and get that checked out.
Okay, and I would assume it would be the same for brittle nails, or if your nails are starting to break easily.
Yeah, there are diseases, and some, again, of the autoimmune diseases like lupus and rheumatoid arthritis. These diseases can have effects on the nails. Psoriasis is a disease that we usually think about plaques of irritation on the skin, but psoriasis can also cause brittle nails and nails that aren't smooth. So there can be various causes of it, and that's worth having that looked at.
Okay, and again, you'd go to your primary care provider for that?
I think that's a good place to start. It would be fine to go to a dermatologist too. Dermatologists deal with problems of the skin mostly, but they also deal with nail and hair problems. So either one would be fine.
Okay, great. All right, so we're actually up against another commercial break, so we need to pause here. But when we come back, your mouth may be trying to talk to you about your health. We'll talk about oral health and what that could indicate right after this. Stay with us. We'll be right back. Welcome back to Healthy Living for Life. We're talking with Dr. Doug Kunzweiler, still this segment to talk about oral health and what your mouth might be trying to tell you about your overall health. So thanks for sticking around with us, Dr. Kunzweiler.
Welcome.
So let's talk about the mouth, and let's start with the tongue. What should you pay attention to as far as colors, texture when it comes to your tongue?
The normal tongue is pink to slightly red and has a bit of a white coat on it. That's normal. And it has quite a bit of texture. It has little bumps all over it called papillae. So changes in color, changes in that texture can sometimes signify other diseases. And so if it's something that persists, lasts more than a day or two, and you don't have a ready explanation for it, that's worth seeing a provider and having that checked out.
And would you go to a dentist for that, primary care provider? Who's your best bet?
I think for this, particularly for the tongue, I think the primary care, because things like thyroid disease can affect the tongue, infections that can infect the tongue. Dentists focus on gums and teeth. They are trained to spot evidence of disease elsewhere in the mouth, but typically what they do, for instance, if they see something that they think might be an oral cancer, they will refer you back to your primary care. So I think starting there, if it seems to be the tongue or the lining of the mouth.
Okay. We talked a little bit earlier in the program about smoking, tobacco, and nicotine. Obviously, it makes sense to talk about that here as well when we're talking about oral health. What can nicotine and tobacco do? What kind of damage can it cause to your mouth?
Well, one of the first things it does is it sort of ruins your taste. It lowers the sensitivity of your taste buds. That's not a good thing. But the main thing we worry about with tobacco and oral health is it leads to oral cancer, cancer of the tongue, cancer of the mouth, cancer of the neck. And those are difficult problems to deal with. We know that people who smoke also have more trouble with gum disease. They have more trouble with tooth loss, with tooth decay. So smoking is just really bad for your oral health.
If you're seeing that kind of damage happening in your mouth, could it also indicate that there are health issues happening in other parts of your body as well?
Yes, most definitely. And the things we worry about most are heart attacks and stroke. And so if tobacco is affecting your mouth, you can be assured it's affecting blood vessels elsewhere in your body.
So this is sort of a chicken or the egg question. So can things happening in your mouth indicate, especially gum disease, that something is happening in your body, or does something happen in your body that then causes gum disease?
Well, it can go either way. Most gum disease is from poor oral hygiene or sometimes poor nutrition, usually oral hygiene. But we do know that if you have significant irritation in your gums, somehow the bacteria that are involved in that also are involved in heart disease and heart attack. So there's a connection there. So most of the time, if you have gum disease, it's because of poor oral hygiene, but sometimes it's another disorder like poor nutrition or even a hormonal disorder that's caused the gum disease.
What about bleeding or receding gums? Is that also just an indication of poor oral hygiene, or could there be other issues going on there?
Most of the time it's poor oral hygiene, but things like tooth grinding or teeth that aren't aligned properly can lead to receding gums. Not just bad oral hygiene, but over vigorous brushing and flossing can also lead to receding gums. And so it's worthwhile to see your dentist if you think you have trouble there. Bleeding gums, usually, again, it's bad oral hygiene, bacteria that's caused a lot of irritation in the gums that makes them sensitive and they bleed easily. Occasionally, it's a nutritional disorder like low vitamin C, or sometimes even a hormonal problem like a low thyroid.
Let's talk about teeth a little bit, since they're bones. If you're seeing issues with your teeth, bone loss, loose teeth, could that be an indication of overall bone health?
It can sometimes. Most of the time, though, that again comes back to oral hygiene.
Okay.
Bad oral hygiene leads to gum disease. The teeth need healthy gums to keep them anchored in the bone of the jaw. And when that gets diseased, then the teeth lose their anchoring, they become loose, and you can lose some of the bone in your jaw. It's not so much connected to the bone in the rest of your body, but especially women who go through menopause and have low estrogen levels, we know that their bones get brittle and their jaw bones can become brittle as well.
Can a sudden increase in cavities say anything about your overall health?
Yeah, and again, there's a link between oral health and heart health. People that have bad oral hygiene are going to have more cavities, and somehow those bacteria that are involved in the cavities cause irritation in blood vessels elsewhere in the body, and we know that that's related to heart attacks and heart disease.
Okay, we're just about out of time. Any closing thoughts about listening to your body for your overall well-being?
Yeah, I think it's most important to pay attention to changes. If you see changes in your skin, if you see changes in your nails, hair, your mouth, if these things persist for more than a couple of days and you don't have a ready explanation for them, it really is worthwhile to see your primary caregiver. Primary care people are trained to evaluate these things and help you.
Great. Thank you so much, Dr. Kunzweiler, for your time and all your advice. And I want to thank Britt Ballinger as well for being on the show today. And thank you so much for tuning in. We hope you'll come back and see us again next week. And until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week, everybody.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.